So, good evening everyone. We're going to have a session on the safe use of medicines where we're going to talk about mainly the European system for pharmacovigilance and as well adverse drug reactions or side effects. As you all know, all medicines have benefits, which is the reason why we are taking the treatment, the intended effect, but they also have risks, which we call side effects. So this is like a balancing act between the risks and benefits of the medicine. Of course, as patients, everyone wants to experience the maximum amount of benefits and try as much as possible to mitigate the risks. So we cannot have this talk without mentioning some historical background, which relates to the development of drug regulation and reporting systems. So I'm sure you are aware, but in the late 1950s and early 60s, there was this drug called thalidomide, which was used to treat morning sickness in pregnant women. And this drug caused a large number of babies, in the order of tens of thousands, to be born with a large range of disabilities, which were birth defects. This defect was called phocomelia, where you had babies with abbreviated limbs. But out of this very sad tragedy came out much stricter regulations for approving new drugs and systems for reporting side effects. So because of this event, we had the first laws in the EU, Council Directive 65/65 and the Medicines Act in Britain in 1968, which still to this day form the foundation. Of course, they evolved as time went on, but it forms the foundation of modern drug regulation and drug safety. We also had the WHO, which launched its program for international drug monitoring, which is a system all over the world for capturing side effects of medicines. And today, of course, we have laws in place to prevent such things from happening. And all medicines, before they are marketed, before they are placed onto the market for use by patients, are authorized. They are given what is known as a marketing authorization. Now, this marketing authorization involves the independent assessment of safety, quality, and efficacy by regulators, so by the different authorities in the member states, like the Medicines Authority, and as well for certain classes of medicines by the European Medicines Agency. And the data for safety, quality, and efficacy is provided by the company after carrying out rigorous preclinical studies, meaning studies in animals, for example, and clinical trials in humans in the various stages. So that is one of the major developments which arise. So here you have the life cycle of a medicinal product. It starts with research and development, and then there is the evaluation by experts in the field, and then it is authorized, and after, very important, there is safety monitoring. So before a medicine is authorized for use, there needs to be evidence of safety and efficacy which is derived from clinical trial results. However, this is a very important point. In spite of the system in place, not all hazards can be established before a medicinal product is first marketed. And we acknowledge that safety information at the time of first marketing has uncertainties for various reasons. One of the reasons is that animal testing is insufficiently predictive of human safety. So although they carry out numerous clinical trials and drug safety batteries, they're called, on animals, mice, and other animals, other species, it is still not predictive enough because we are, of course, humans and we are a different species. As well, something else which is very important, the data from clinical trials is limited in terms of trial size, duration, and controlled environment. So, to give you an example, some side effects are very rare. For example, 1 in 100,000. And clinical trials would not recruit enough patients to be powered to be able to detect these very rare events. As well, they are controlled by duration, so you can have side effects which arise from chronic use. For example, when you take a medicine day after day for several years, and we know that some classes of medicines like antihypertensives and drugs for cholesterol, those you take them chronically. So certain side effects which emerge from chronic use cannot be detected if the clinical trial would be, of course, limited in duration, like for example 6 months or 1 year. And something else which is important, that special groups of patients which are vulnerable, such as children or the elderly or pregnant women, aren't normally included in clinical trials. So for all these reasons, and as well drug interactions, you have drug-food interactions, drug-disease interactions, and all the complexities which arise when the drug is used in a widespread manner in the whole population. So for these reasons, regulators, which are the authorities in the different member states, and marketing authorization holders, which are the drug companies, must maintain vigilance for safety issues that emerge with widespread use of a medicinal product. And we call this pharmacovigilance. Now, if we examine the word pharmacovigilance, you have the word pharma, which indicates related to pharmaceutical industry, to medicines, and you have the word vigilance, to be vigilant. And this concerns the evaluation and control for any new side effects which arises from the use of medicines. Now, if we were to provide a definition of pharmacovigilance, it is the science and activities related to the detection, assessment, understanding, and prevention of adverse effects or any other medicine-related problem, and this was provided by the WHO. So here in the definition, in fact, you can see that pharmacovigilance has a number of different steps, ranging from detection, picking up the side effects which happen in clinical practice, the assessment, seeing the relatedness between drug and event, for example, and then ultimately understanding and trying to prevent such problems before they arise. So we are, of course, nowadays trying to move to a more proactive approach to prevent problems rather than being reactive. And here you have the aims of pharmacovigilance, what we try to do with pharmacovigilance. Of course, to improve public health and safety through early identification, very important, of potential safety hazards, to contribute to the assessment of benefit, harm, and effectiveness and risk of medicine, to implement regulatory action, and we will see what we mean by regulatory action in later slides, and to minimize the risks associated with medicinal products. As well, very important to promote effective communication to the public and to patients, and to promote the rational and safe use of medicines. So the question arises, how is the safety of medicines ensured once they have been put onto the market? So once they have been authorized medicines in the EU, we are in Malta, which is part of the EU single market. Okay, the European Medicines Agency and the member states and the companies together continuously monitor the safety of medicinal products, and if needed, regulatory action is taken. And this occurs when the benefit risk, that sort of balance, is changed because of emerging new information. Now, in Malta, it is the Medicines Authority which is responsible for the coordination of the national pharmacovigilance system, and the authority monitors the safety of medicinal products, which of course covers various medicinal products. You can have over-the-counter products like paracetamol, you can have prescription products, you have blood products, vaccines, biologicals, and as well medical devices on the local market. The European Medicines Agency also has a role in this system, especially in the EU pharmacovigilance system, and it operates very important services to support the member states. One of the most important things that the EMEA provides is the database EUDRA Vigilance, which is the European database for adverse drug reactions. So whenever we receive an adverse event or an adverse reaction, we transmit it to this database. And when you have this data, this collection of data, you are able to see trends and associations and then be able to take action. Okay, so this is very important because the member states will pool all the safety data from all the patients in Europe, and then there is more power to be able to take the necessary decisions related to medicine. It also hosts the PRAC, the Pharmacovigilance Risk Assessment Committee, which supports pharmacovigilance in the EU. And this I am mentioning it because since we are a single market, if a medicine, for example, is considered unsafe in a member state, it is not acceptable that another member state says it is safe for our population. So that is why there is this harmonization together. The EMEA really is made up of experts from the member states in the different committees, and there are monthly meetings, monthly plenaries, so they discuss any issues which arise for medicines, and there can be various. So something else about this committee, it is based at the EMEA. It is responsible for all matters related to pharmacovigilance at an EU level, and if you are interested, the EMA publishes all agendas, minutes and highlights of the PRAC meeting to allow transparency of the decision-making process. Something else which is of interest is that in the PRAC there is one member and one alternate representing patient organizations as well. There is a representative as well of the healthcare professionals, so in this way patients as well are involved in the decision making and they are not left out. Now I'm going to pass on to my colleague Sarah Abela, who's going to take us through more about adverse reactions.
Good evening everyone. I will take on from Benjamin and discuss further on medicinal products and adverse events. We'll start off by pointing out the different factors which can predispose us to adverse events. So perhaps, as Benjamin said, during a clinical trial you're not including children, pregnant women, elderly, but in reality everyone tends to use medicinal products according to the indication, yes. But then you start seeing real-world evidence. What does that mean? So in practice, the age, concomitant use of various medications. We know that the elderly consume a lot of medication. Polypharmacy can cause or can increase the incidence of adverse events. There's obviously concomitant use of vitamins and dietary supplements. There's widespread use among patients. But even though they are natural sometimes products, they can still cause side effects or interact with the drugs you're taking on a daily basis to cause reactions. As Benjamin pointed out before, having a certain condition or disease can also predispose you to having an adverse event. So these are all things which are picked up later on once a drug is on the market. The important thing is that these are captured and recorded. There are the common adverse events, which I think everyone is familiar with: the nausea, headache, dry mouth, tiredness, etc. And we have classifications for adverse events. They can be classified as serious or non-serious. In fact, even if you read in a leaflet once you've got a pack, within a leaflet, they are categorized as serious and the common adverse events as well. So how should we use medicine safely? What can we do to use medicine safely? As I mentioned, there is a patient information leaflet which can be found either stuck onto the pack or inside a pack of each and every medicine which we use. And this has very important information that should be pointed out to patients. We can find on it information such as what the medicine is, the information about the medicine, what it contains, the dose. Very importantly, what not to do as well, so when not to take a certain medication. The indication, so when and how it should be used. So it's important to follow a certain indication. Obviously, if you're using something off-label, then you can cause or increase the risk of certain adverse events. There is further information about each and every ingredient. So it's not just the active ingredient. If we were looking at paracetamol, it will also contain other ingredients which are carriers for the drug to be delivered. And for those with allergies, sometimes if it's something, I don't know, I'll pick out, something like sodium bicarbonate. I'm taking an example from over there. You might not know that a certain medicine contains such an ingredient, so it's also always good to refer to the product information leaflet.
If I may as well, something which I experienced in clinical practice as well, sometimes patients change brands from one brand to another. And you can have instances where the formulation is different. So the medicine which you usually take as a filler, as a binder, because the pill itself has the active substance, and then other substances which make up the bulk of the tablet. You can have one which has microcrystalline cellulose and you're fine. But then you can have another brand which uses lactose as a filler. And I have seen patients who do well on certain medicines, but then they switch brands and they experience gastrointestinal symptoms. And when you in fact look at the leaflet, you will say that this medicine contains lactose. So in actual fact, the adverse event which happened was due to an excipient, not the actual medicine. But it's good to be aware of this. So if you have some form of intolerance, you can always check the leaflet to make sure you are not taking in things which you are allergic to.
Other things found on the pack this time, so moving on to the pack, you will find the name, that is standard, the active ingredients, so in this case it's ibuprofen and codeine, the number of tablets, the amounts in milligrams, etc. You also have the most common, in this case here, the indications, storage condition. Obviously, if you're going to store a medicine, if you're going to keep your pack in the car in our sun in summer, you're going to cook your medicine, so it's not going to work, and that can either cause side effects or it can render the actual medicine ineffective. So you'll be taking it for nothing, but still exposing yourself to adverse events. So storage is always very important. One of the reasons why medicinal products can't be changed once they've been sold from a pharmacy is because of this, because we cannot guarantee once the product has gone out of the pharmacy that it's been kept within the conditions that it should have been, then once it is returned, unfortunately. There are the serial numbers related to the authorization of the product. There are warnings as well on the pack, as you can see over there. And also, most importantly, the expiry date and lot number. These need to be sometimes referenced when there are recalls of products, so it's something that it's also a very important part of the packaging. Braille is also found on some packages, not everything. It is a method for people who are blind. It's a way of recognizing their medication. And something else which is good to mention is that within the pack, so on the film, on the blister pack, we also have the expiry date. A note that I wish to make here is that once a medicine is expired, it may become ineffective. So here, one also has to weigh the pros and cons. If you're going to take a medicine which has expired, you're exposing yourself to more side effects, and at the end of the day, you might not be getting the full benefit of a product. So an important thing to note, and something as a note, not to take medicines which are expired, beyond their expiry date. Routine pharmacovigilance, it falls under 4 pillars, so to speak. So we have the summary of product characteristic, that leaflet which is found within the pack. And that is information for patients, it's information for healthcare professionals, so for the pharmacists, for the doctors to read up about the medicine and how it can be used. Then, there is what is called as ADR reporting and signal management, something that Benjamin touched upon, but I will be speaking about now. So there are systems in place at a national level and at an EU level whereby we capture adverse events. This is important because from these adverse events we're picking up signals. Some of them adverse events can be of a certain proportion that they cause mathematical correlation. Benjamin will be able to explain this to the full.
Without going into too much detail, the way it works, you have all the data going into the database and you have this pool of data. Now, all medicines cause side effects, but certain medicines cause certain side effects at a much higher proportion than would be expected by chance. So you would have a statistical association, like smoking and lung cancer. They are statistically associated, correlated. And then, once you have this mathematical spike, that is a signal which warrants further investigation. Of course, we do not just rely on the mathematical association. We need to evaluate the case medically, because sometimes you can have a false positive. Like, for example, if you are diabetic and your diabetes has gone uncontrolled for many years and your doctor prescribes insulin, and 2 weeks later or 3 weeks later you lose a toe, the losing of the toe is related to your underlying condition and not to the actual medicine. So there could be false associations. So that is why we need people like Sarah, who is a safety assessor, to actually evaluate the side effects which come in, so we are able to take better decisions and more informed decisions.
Exactly. There is also literature monitoring, so physicians and other healthcare professionals might write papers. As you know, you have the medical journals. Within these journals, there's screening of these, and you can pick up adverse events. So literature monitoring is also carried out to pick up adverse events. And there is the aggregate review of cases, which then, as Benjamin said, give rise to signals. There is also what is called a risk management plan. So every product which is authorized on the market needs to have a risk management plan. Here we find the identified risks, potential risks, and any missing information. And this will describe the medicine's profile. And it helps as a guide to see what to look out for in the future with this particular drug. And you keep compiling information for this drug as long as it's on the market to ensure that the safety of this product remains. Anything which is found to be unsafe will either be suspended, and at times there might need to be a recall, a product recall. Within the risk management plan, there is also a description of how you're going to prevent risks or minimize them. As an example, I'll mention the use of a pregnancy prevention program, whereby if there is a medicine which should not be used in pregnant women, for example, acne treatment like retinoids, you will need to make sure that the patient does not become pregnant. So you need to advise the patient, educate the patient about anything that might, about the side effects that can happen during pregnancy. And at times even there needs to be contraception, or advising the patient to take, to avail themselves of contraception. There are also plans within the risk management plan for studies which can be carried out post-authorization. And the risk management plan also describes measures to effectively minimize risks to patients. There is also a periodic safety update report for a particular product. Once it has been approved on the market, there is what is called the safety update report, which is submitted periodically by the company. So within this report, you will find a list of adverse events and any literature reports which have come out in the public. And these are submitted by the marketing authorization holders at defined time points to the national competent authorities, who then review and ensure that, yes, the product is safe to still remain on the market. So additional pharmacovigilance and risk minimization measures. As an example, here I will mention patient reminder cards, so a reminder to take your medication, for example, with food or without food, or not with a glass of milk but a glass of water, for example. There are education materials even for prescribers, so we're not just talking about the patients, but also prescribers need to also be informed of what to do to minimize adverse events and risks to patients. Sometimes we will need to issue dear healthcare professional letters, which is a particular letter for covering a safety aspect of the product. So if there's a new safety issue which needs to be communicated to healthcare professionals, this would be the tool that we use. I mentioned the pregnancy prevention program for retinoids, valproate, etc. And they are implemented, as I was saying, where there is a teratogenic effect or an adverse event that can affect the neurodevelopment of a child through exposure in utero. For risk minimization measures, I would like to say that these are educational materials which are given to healthcare professionals and patients, as we were saying, and will explain the use of a medicinal product and how to minimize risks. It can be in the form of a brochure, it can be in the form of patient reminder cards, training programs to patients, instructions of how to handle a product, either how it's reconstituted, mixed, or even how it is administered at times. I remember with a certain product, for example, you would need to be very well hydrated before it is administered. So these are things which will minimize the adverse events. Not all medicines will have additional risk minimization measures, so you don't need anything to prevent the adverse events because of the nature of the product. So this is an example of a risk minimization material, of an education material for Mayzent, Siponimod. And here it's a patient and caregiver guide. Things to look out for before having the product. So for those, I don't know if there are any other, if there are any foreign speakers or non-Maltese speakers. Basically, this is explaining what to do here before.
Here the point we wanted to make here is that the risk minimization measures and the material for patients is available both in English but even in Maltese. So not just because it's prepared by a foreign company, we make them the obligation to make them either in English or Maltese, so they are more accessible, especially to patients who are not very well versed in English. So this is why we put up this slide. It's an example of a risk minimization measures in the Maltese language.
And these are also available on the Malta Medicines Authority website. They are all archived there and available to the public. Now, moving on how to report side effects, we have a little video. I don't know if I can.
We can try. I'm not sure if we have internet.
Let's see.
No. But it's this video is a very simple infographic animated video which shows how when one reports, one is making medicine safer. So as we said, we collect the reports, they are funneled into the system, they are picked up, they are assessed. There is regulatory action, which many times regulatory action is nothing drastic. It would just be, for example, to introduce a warning into the leaflet or to list the side effect, for example. So the patient is better informed and better empowered to be able to take his decisions and to be aware. So if we have a medicine which is causing a certain side effect, what to look out for, when to worry, when to talk to your doctor, so the patient is better equipped. And this would allow even prescribers to make better choices for the individual patient, because everyone is different, the medications are different, and based on the safety profile of the product, you would select a certain medicine over another. And when the data is more complete, the decisions can be better. But that's what the video is showing.
Now this is how patients can report adverse events. So reporting adverse events is not just for patients or doctors only, it is for everyone. And on the Malta Medicines Authority website, patients are able to report adverse events. This is, so one needs to go into Contact and Connect, report a side effect. This will take you to our adverse drug reaction page, and you can report your side effect online directly to the Malta Medicines Authority. The form is very simple and straightforward. Something that I would like to say is be concise, because the more concise, the less vague terms are kept, the better the information. So data needs to be of good quality. What goes into an adverse event report? The patient initials, the gender, the age, weight, ethnicity.
These are optional, by the way.
These are all optional.
But we need to have
wherever there is
some form of identifiable characteristic to make sure these are real reports and not people trying to game the system or with other intent. So as long as we have some form of data on a patient, then it is a valid report. But if you don't feel comfortable disclosing this information, you don't need to disclose it. What we would need is the contact email. So contact email and patient initials, that is enough, so you have a valid report.
Obviously, the more the information, the better the report. Because if we know that a certain reaction is happening more in males rather than females, then that is why, just to give context as to why there is this information. But as my colleague said, it is optional. There obviously needs to be the details about the suspect medicinal product, so the one which is causing the adverse event, any other medicines which are being taken at the same time. This will allow for us to know whether there have been any interactions, side effect details, so we're describing the adverse event, when it started, if we know, when it stopped, if it has stopped or if it's still ongoing, and how serious you feel that the adverse event is. Whether it's been fatal, life-threatening, it's caused or prolonged hospitalization, whether it's resulted in a birth defect, caused the disability, or other medically significant issues. So, how should healthcare professionals now, talking about from the aspect of the patient, from the physician or the pharmacist or nurse. So healthcare professionals need to download the paper form from our portal, and this is then forwarded to us by post. So it can be printed from over here. I don't know if there are any healthcare professionals present with us today. Okay, so the form is downloaded from the website over there. If you encounter any difficulties, feel free to contact us, the Medicines Authority, and we will provide this form. The form is very straightforward as well for healthcare professionals. It has gone through a redesign. It was redesigned in 2013, and it combines both medicinal errors and adverse events. So in one form you can report either one or the other or both at the same time.
Here what we want to present here is that this is for healthcare professionals, but it's good to appreciate it as well. We improve the form by changing it a little bit, subtle fields. So when we evaluate adverse reactions, one of the most important things to know is the time between taking the medicine and experiencing the adverse event. We call it time to onset. And before, the date field was just one box. So we used to have several reports being a bit vague. For example, the drug was started in July and the event happened in July. And like that, you cannot come to a conclusion on time to onset. So the date field now is split up into 3 with month, day, year. So that is a visual guide to the reporter to give a specific date. Of course, the closer the event is to taking the drug, the more likely it is that it is causing it. But this is what we are presenting here on this slide.
Other details, here we're trying to understand the decision tree. There's a decision tree for the adverse event. Section 1 here is where the reporting for adverse event, or where the details go in. There's the patient details in section 2, and in section 3 we require the reporter details. On the last page there are also instructions for reporting. Now, the reports can either be printed, filled in and sent by post to us. They can be filled in, Word, emailed once they're scanned to the post licensing at Medicines Authority at gov.mt email address, or sent to the marketing authorization holder of the product, the details of which would be found in the pack. Obviously, avoid sending to both companies because that would cause a duplication of report and it may give rise to wrong signals. But that is why as much information is collected, because if we realize that there are 2 reports of the same patient, then that would help us to filter out the data. There are some additional resources available on the Malta Medicines Authority website for healthcare professionals. There's a guide for reporting adverse drug reactions, some notes for healthcare professionals. They have notes and instructions on what is required for adverse event reporting. The ADR reform for healthcare professionals also contains a detailed step-by-step instruction, as I was saying, overleaf, so in case one would need to refer to it. In essence, what we should do when we're experiencing adverse events. So if anyone has experienced an adverse event, it's always good to talk. Inform your healthcare professional, inform your physician, your pharmacist, your nurse. This is very important. This collection of data will help improve the safety of medicines, which is the essence of pharmacovigilance at the end of the day. Patients, as I was saying, can report through healthcare professionals. Something that we would like to mention is that any information that is passed on, any data on names or identifiable data on patients or reporters are redacted once the report has been processed. So once it gets to us, we will make sure that it meets a certain criteria and the data is inputted in user vigilance. We do not keep personal information of patients or physicians. The 4 data elements which are necessary for a report to be complete are so we'll start with the patient information. So to identify that there was an actual patient, as Ben was saying, so that there aren't any fake reports or someone trying to cause any issues with the medicine. The name of the medicinal product, it's not enough just to say, I don't know, a drug for a painkiller, for example, right? Paracetamol or ibuprofen. Even better if you write the product name. So if it's, I don't want to mention any brand names, but Panadol, everyone knows it, but try and be as specific as possible. The description of the ADR, and ideally not patient fell ill, patient was upset, had a tummy upset. Try to be specific. So what was it? Was it a headache? Was it a strong headache? Was it a migraine? Nausea? Was it, if it's something to do with the digestive system, be as specific as you can. And any contact information of either the reporter or of you if you're reporting as the patient, because this will help us contact you if we need to follow up on the adverse event. So I was mentioning data quality and how this will make us assess the adverse event better. So we need to assess the event for causality assessment. As Ben was saying, one of the things that we assess is the time to onset. If you've taken a drug in January of 2018 and you experience a side effect in December of 2018, depending on how long you've been taking the drug, then if it's one you've been taking chronically, it might have been related. But if you just took it once and it happened, I don't know, 2-3 years down the line, there might not be any relation. So that is why then we assess the adverse event. Good quality data will result in better causality assessment and appropriate time, and we can take regulatory action at the right time. So as much as possible, be concise and give us the right terms and data. The information to be included, as we were saying, patient details, details on the medicine, information about the side effect, the start and stop dates, concomitant medication and concomitant disease or medical conditions.
Go on back.
Yes?
Name, not your full name, even initials is enough. TJ, AM, or if not initials, female, or 30-year-old. That's enough. You don't need to identify yourself.
I'll just skim through this as we've been saying it repeatedly. So avoiding ambiguous terms, being accurate, specific, and any past medical history especially can be very important, and the outcome of the event is also something that we follow up on. When indicating laboratory data, the report units and ranges are also important. So if you're saying the blood pressure was high, how high was it? If you know the reading, then give the actual reading. Once you've reported an adverse event, this is sent to us. It goes in through the system, as Ben was explaining before me. And if there's a flag, if there's a signal, then it is further analyzed. And yes, you are part of the system to keep medicines safe, to ensure that your medicines are safe. The system in the EU is the same for all EU countries. So once we receive these spontaneous reports at either us, the Medicines Authority, or the company received by the medicine companies, these are entered into a database called EUDRA Vigilance, which contains it's a database for all the EU. These adverse events are analyzed and passed through, they are analyzed even statistically. If any statistics are raised, they go to PRAC. They are reviewed by PRAC. If PRAC needs to take any specific action or decisions, this goes then to the CHMP, which is the Committee for Human Medicinal Products. Once this committee takes a decision, it then goes to the European Commission and the decision is reached. Further to this, then there might be the need for regulatory action. And what do we mean by regulatory action? It might mean that there is an additional warning included in the patient leaflet, or perhaps a new risk minimization measure needs to be included, like a patient card or a physician leaflet. It might be the case that yes, a drug is suspended or it's withdrawn from the market and recalled. So the whole sequence of events and the whole chain reaction is ticked off once there is this data collection. The MMA monitors the safety of medicinal products even at a local level, and we are constantly trying to educate patients and healthcare professionals in the rational use of medicines. Obviously, you might say, yes, well, I'm a patient, I'm very bothered by a cough, let me take double the dose of this cough medicine because it's really bothering me and I want to get rid of it. No, you might not be doing the right thing there, but it's not the rational use of the medicine. You're exposing yourself to added adverse events and you're not necessarily getting the desired outcome. So something that we promote at the authority, and we, as an authority, we manage the adverse events, so we're transmitting them to EUDRA Vigilance, as we were explaining. We raise potential safety signals to the PRAC. Benjamin is also a committee member. a backup member. We participate in EU decision making on regulatory actions at the level of the EMA. We communicate safety issues via those healthcare professional communications which I was mentioning, and safety circulars, which are also, by the way, available on the Medicines Authority website. They are all kept, they're public, and anyone can have access to them.
What I may add, the DHPCs are meant for healthcare professionals. The safety circulars have a section for patients as well. So if there is a review going on for a certain class of medicines, there is an explanation for patients. Listen, this medicine is for this, this and that. This is the problem. This is what is happening. For example, do not stop the medicine, because you run the risk, if you are being too alarmist, that you stop the medicine, and certain medicines are needed. So you could be doing more harm than good by stopping a medicine all of a sudden. So that is why we have, because you might read on the tabloids or on the internet that this medicine is causing some hideous side effect, but you have to be careful when reading such information. It would be preferred if you check these trusted sources like our safety circulars to get to know exactly what the problem is and what you should do. It might be the case as well that the medicine would be withdrawn and there would be advice to speak to your doctor so he changes you to another medicine. But it's always important to involve your doctor in such decisions.
Exactly, and more importantly, check the source of your information. That is always the number one thing to do. On the sun, and it's another thing if you're seeing it on from a reputable source.
How does this information reach the patients?
It's on our website.
Yeah, well, as a patient, I don't go every day on your website.
No, of course not. We don't publish a safety circular every day. We publish a safety circular when there is the need. And in fact, if I'm not mistaken, I think the Malta Health Network is one of the stakeholders which we send the email to, if I'm not mistaken. But we can discuss how we can improve
Our outreach.
This outreach.
Mm-hmm.
In fact, something else which maybe patients are interested in, we have a subscribe section. On the website you can subscribe, and whenever we publish a circular, a notification is pushed to the subscriber so they can check. You either receive an SMS or an email. Listen, the authority has published a new safety circular on this and that, and there is the link, and you can, if you want, check it out.
We can start promoting
Yes. This is essentially what we've been saying all through. So we're reporting adverse events to make medicine safe, to prevent future harm to patients, to encourage a safer prescribing and use of medicines, improve patient safety, and ultimately protect public health, and to improve medicines information and education. Malta Medicines Authority participates in what is called Med Safety Week. It happens every November, and it's coordinated with the European Medicines Agency. This is we issue public.
It's a social media awareness campaign.
Exactly.
To promote, listen, if you experience a side effect, you can report it.
For promotion and education.
That is the aim, and we try to keep with the times and use some humorous animations to draw attention to this issue. But whoever wants can follow us on the social media, and whenever we have such campaigns and initiatives, one can be informed and be aware. So that's it.
That's it from us. Thank you very much for your attention. If you have any questions, we're here now or later after the presentation. So
and if you want, you can contact us.
We may be reached. Yes.
You mentioned before when drugs are assessed for the side effects, they are assessed on healthy individuals. Not on children or the elderly. So how are medicines prescribed for kids and the elderly?
Well, what we presented was a general statement of what happens normally. Of course, the clinical development program and the clinical trials would reflect the patient cohort which is going to be treated, the indication. But for normally certain patient groups like pregnant women and even very young children are not included in the clinical trial. This of course is a limitation, but we have to accept that there are certain difficulties with using children in clinical trials. There are ethical concerns, concerns of consent. You have as well immature organ systems as well in children. So there are difficulties. It doesn't mean that no medicines should be used in children or that they are unsafe. What we're alluding to is that the information is incomplete at the time of first marketing. And then as time goes on and as there is more experience, even in the clinical sense, then certain decisions can be taken by the prescriber to use the medicine as it is needed.
Thank you.